Okay, 360 of the room. Okay, showing my Seneca ID. My name's Marianne, Marie-A-N-N-E Dodds, D-O-D-S. Okay, so I'm going to start out. Knock, knock. Hi, my name's Marianne. I'm going to be your nurse for today. I'm going to be performing a physical assessment. I'm going to perform hand hygiene, put on gloves, and close the curtain for patient privacy. So, can I check your ID? And can you tell me your name and date of birth?
Will Smith, April 25th, 1927.
Great, thank you so much. So I'm going to be performing a head-to-toe assessment on you today. How are you feeling?
I'm feeling okay.
Okay. Is it okay if I get started? Are you comfortable? Do you need to go to the washroom before we start? Okay. So I'm going to ask you a couple of questions. Just answer them for me. So what happened?
I tripped over my rug and I have hit my head on the
You
side.
hit your head? Okay. And do you have any pain right there?
Yes, it does hurt where it hit.
Okay. And can you describe the severity on a scale of 1 to 10?
I'd say about a 4.
About a 4. Can you describe the type of pain to me?
I would say throbbing pain would be the
throbbing.
best explanation.
Okay. Is the pain radiating anywhere else?
Just the one spot.
Okay. Have you taken any sort of pain medication?
No, I haven't taken anything for
Okay.
it.
Was there just pain after the fall, or was there any prior?
Nothing prior, just from the incident.
Does anything make it better or any worse?
Nothing, no.
No? Did you feel any bleeding or any sort of discharge come out?
No,
Oh.
just hurts.
Okay. And is there any other type of pain in your body, not just like radiating anywhere else? No? And do you remember what happened after the fall?
I crawled to my phone to call for an ambulance.
Okay. So looking at your body's physical appearance, I see there's no unusual odors, look is appropriate for the age, and color is normal for ethnicity. Body structure, standing erect in the chair, body is symmetrical, no obvious physical deformalities. And seeing the behavior, their neutral mood, no crying, no grimacing, maintains eye contact when speaking, and is dressed appropriately for the assessment. Can I get you to take a walk down to the door and then back again? Okay, normal gait. Can you have a seat for me? Okay, I notice that there's no respiratory distress, regular breathing. Can you tell me where you are, who I am, and what date it is?
We're at the hospital, you're in nurse Dodds, and I believe today is August 7th, 2025.
Okay, so patient is alert and oriented ×3. I'm going to get started with the physical assessment. So I'm going to start by palpating the scalp. When I palpate, I notice that the skin color is appropriate for ethnicity. There's no redness, there's no swelling, there's no lesions, no scarring, no masses, no lumps, no bumps. Do you feel any pain or tenderness when I do this?
Just where I've hit my head.
Just right here? Okay. And then when I take a look at the hair, I notice that it's a blonde-brown color, it's straight, long, the proper hygiene, no foreign bodies. Okay. So now I'm going to take a look at the facial structure. While I palpate and observe, I notice that the skin color is appropriate for ethnicity. There's no redness, no swelling, symmetrical, no scarring, no lesions, texture is appropriate, and no involuntary movements. Okay, is there any pain when I do this? No, none at all. Great. Can you smile? Show your teeth. Great. Can you frown? Can you raise your eyebrows? Shut your eyes very tightly. Puff out your cheeks. Okay, face is symmetrical when we do this. Now I'm going to take a look at the eyes. So while I inspect, I notice that there's no discharge, no crustation, no redness, no ptosis, no exophthalmos, no drooping, even lash distribution, and the eye color is blue. I'm going to start with the Perla test. So I notice that the eyes are round and symmetrical. And before I test for reaction, the pupils are at a 6. Okay, both eyes react to light and then go down to about a 4. I'm going to get you to stare down at the wall. Don't turn your eyes to the object, testing for accommodation. All right, eyes accommodate for object. Now don't move your head. I'm going to move this up and down. I need your eyes to follow. Checking for cardinal gaze. Up, down, side, side. Okay. Now doing the confrontation test. Can you, no, don't look. I need you to see if you can check in your peripheral. How many fingers am I holding up?
4.
How many am I holding up?
I looked, oopsies, 2.
How many?
1.
How many?
4. 3. 2.
Okay, thank you. Now I'm going to do a Snellen chart test for you. Cover one eye. Are you able, which one are you able to read?
The second one from the bottom, I think.
Okay, can you name that for me?
9, 3, 7, 8, 2, 6.
Okay, so patient has 20/25 vision on left eye without any glasses. Okay. And now, moving on to the ears, while I inspect the outsides, I notice that they are symmetrical. I notice that the ears are aligned well. There's no redness, and there's no discharge, and there's no excessive cerumen coming out. Do you feel any pain or tenderness while I do this? Okay, no tenderness present while we palpate the auricle and the tragus. Okay, now observing the outside of the ear. I notice that there's no redness, no lesions, no swelling, and no excessive discharge. Same on the other side. Checking the inside of the tympanic membrane. No perforation, no swelling, no redness. No perforation, no swelling, no redness. Okay, great. Now I'm going to do a whisper test. I'm going to say 3 words that I need you to say. Okay.
Plant TV remote.
Okay.
Water bottle, phone, detergent.
Yes. Okay, great. Thank you so much. All right. Now I'm going to perform the Ryan and Weber test. Tell me if you feel even vibration on each side of your head.
Yes.
Okay, do you hear that?
Yeah.
Do you feel that?
Lightly.
Yeah. Do you hear that?
Yes.
Do you feel that?
Lightly.
Okay, great. Now I'm going to take a look at your mouth. So when I look at the lips, I see that they are pink and moist, no cracking. And then the gums, they are pink, moist, no lesions. Looking at the teeth, I see that they are all present, no looseness, no caries. And then can you open your mouth? Okay. And tonsils are intact, no swelling, no redness. Hard palate and soft palate is intact, pink, moist, and no lesions. The tongue is symmetrical and pink. And then can you say ah? Ah. Okay. And then can you move your tongue side to side? All right. And can you say light, tight, dynamite?
Light, tight, dynamite.
Okay, thank you. Now, can you turn your head this way, that way? And can you raise your arms against my, shrug your shoulders? Okay, thank you. So now, looking at the upper extremities, I notice that the color is appropriate for ethnicity. There's no redness. There is 1, 2, 3, 4, 5, 6, 7 tattoos present. 8, 9, 9 tattoos present. Even hair distribution, no skeletal deformalities, no masses visible, no scarring, and no lesions. So while I palpate, I notice it's warm to touch, moisture present, no tenderness or pain in the joints, warm joints to touch, no masses underneath the surface, normal tugger present, and no abnormal texture. Okay. Are you able to get onto the bed for me? Actually, can you get back on?
Yeah.
I'm just gonna take this back. I'm going to take a look at your nails now. All right, so the shape is round. The color is pale and pink. It's a flat and longer shape, going angle, and they are artificial nails as well. I'm going to get you to do a couple of movements. Can you flex, release, flex, extend, flex, extend, trigger shoulders inwards, outwards, and then roll them backwards, forwards, and can you put your hands up, sideways, all the way around? Okay, and can you grab my hands? Squeeze them tight. Okay, even squeeze. Was there any pain? Okay, no pain, no crepitation, no altered range of motion. So now I'm going to get you to get on the bed for me. Thank you. All right, so while I observe the lower extremities, I notice even hair distribution, no skin colors appropriate for ethnicity, no redness, no edema, no swelling, no scarring, no lesions. What else? Muscle tone is slim and even, and no abnormal visible skin texture. While I palpate, do you feel any tenderness or pain while I do this? No. Warm to touch. No tenderness or pain in the joints. No. And then no abnormal texture. Muscle bulk is even, slim, and tugger is normal. And then there is also no mass or lumps underneath, and no and there's moisture present. So looking at the feet,
Should I remove my socks?
I can do that for you.
Sorry.
Okay, so while I palpate the feet, I feel the dorsal-pedis pulse. It's even, strong, and then dorsalis posterior radius pulse, even and strong. All right, thank you. Put your feet back down. Okay, plantar flexion. Dorsiflexion, plantar flexion, bilaterally. Okay. Any sort of pain or crepitus when you do that? No. Okay. So now I'm going to remove my gloves, perform hand hygiene, put on new gloves. Okay, can you get up and get back in the chair? Can you turn the other way, actually? Okay, like back to the camera. And
Oh, sorry.
can you tie back your hair?
Yeah. Sorry.
Okay, so while looking at the posterior, I noticed that the skin color is appropriate for ethnicity. There's no redness, no edema, no skeletal deformalities, no scarring, no lesions, even hair distribution, and no obvious masses or lumps. And then while I palpate, I notice warm to touch, moisture present. Any tenderness while I do this? No. No masses, no skeletal deformalities, regular tugger present, and no lumps, and what else? Even muscle distribution as well, slim, light. Okay, now I'm going to do the tactile firmness test. So when I move my hands down, I need you to say 99. I'm going to feel the vibrations. All right?
99, 99, 99, 99, 99.
Okay, and can you take a deep breath in and out? Okay, so symmetrical expansion. Now I'm going to percuss. Okay, tympanic sound. Now I'm going to auscultate. Disinfect the stethoscope before I start. Okay, can you take a deep breath in and out? In, out, 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 in again, and out. Okay, thank you so much. I need you to get onto the bed for me. Okay, so I'm going to check the cardiovascular. So, listening to the aortic valve. All right. S2 louder than S1. Listening to the pulmonic valve. S2 louder than S1. Ebb spot. S1 and S2 even sounds. Tricuspid valve. S1 louder than S2. Mitral valve. S1 louder than S2. All even, strong, irregular rate. Okay. And now observing the abdomen. Thank you. I noticed that it's flat surface, skin color appropriate for ethnicity, no redness, piercing at the umbilical, that's in the midline, tattoo on the right thoracic plane, and then no lesions, no lumps, and no scarring. So now I'm going to palpate. Do you have any pain when I do this? No pain or tenderness present, no surface lumps, regular texture, and warm and moisture present. Now I'm going to take a listen at the vowel sounds, starting in the right lower quadrant, right upper quadrant, left upper quadrant, left lower quadrant. All vowel sounds present in normal. Now listening for brooding in the aorta. Right renal, left renal, right iliac, left iliac, right femoral, left femoral. Okay, no brooding sounds present anywhere. I'm going to do the Murphy sign test. Okay. Rebound test. Thank you so much. And now I'm going to do the costovertebral angle tenderness. Have a seat here with your back facing the camera. Thanks.
Still in my hair.
Okay, let me know if you feel any pain. Any pain?
No.
No? Okay. Now can you take a look more without the camera? Take my second peek. Okay. Now I'm going to test the neuro. So I have a little cotton ball here. I need you to tell me if you feel it. You're going to say now. Close your eyes.
No. No.
Okay, open your eyes. Now, this is the dull side.
Okay.
This is sharp. I need you to tell me what you feel.
Okay.
Close your eyes.
Dull. Sharp. Sharp. Dull. Sharp. Sharp.
Okay. Tickles. Okay. Stereognosis test. Put your hand out. I'm going to place an object. Close your eyes, and I need you to tell me what it is.
A coin.
A coin? Thank you so much. And then open your eyes. I need to test for if you can see your orientation. I'm going to lift your finger up or down. I need you to tell me if you feel up or down.
Up. Down. Down. Up. Up. Down.
Okay, thank you. Now I'm going to test for your reflexes. So I'm going to start with testing the bicep. Bicep reflex present. Bicep reflex present. Tricep reflex present. Tricep reflex present. And then brachioradialis present. Present. Okay. Can you just stand up for me quick? I need to test another reflex. Have a seat and relax your knees. Relax your knees. Okay. Patellar reflex present. Achilles reflex present. Achilles present. No one's present. All right. Stand up for me. Okay. Close your eyes. Okay, Romberg's test. No problems with balance with eyes open or closed. Open up. All right, now can you do a regular heel toe walk down? A toe walk down.
Toe walk
Like
that
just
toe
on your
heel.
toes.
Oh,
just on your
tiptoe?
toes.
Okay.
And then your heels. And then come back. And then can you put your arms out all the way at your shoulders? Okay. No pronation or supination. And that completes the assessment.